Hello, my name is Dr. Sharma, and if you're watching this video, it's most likely you will be proceeding with a hair restoration procedure. This video surrounds itself around the risks and limitations of the hair restoration surgery. We must balance the risk of complications versus the proposed benefits of the procedure. And I hope this video further elaborates on the consent form which was sent to you via email. So now we're going to talk about limitations and alternative treatments. As hair restoration procedure is cosmetic in nature, one of the main alternatives to this procedure is actually to do nothing because it's not required for health. Other alternatives and options include wearing a hairpiece, using oral medications, and also there are different methods of performing the surgery. If you're having an FUT surgery, you can always proceed with FUE surgery, FUE vice versa to an FUT. There are different ways of harvesting the grafts from the back of the scalp. There are motorized devices which are operated by hand. There are robotic devices which are monitored by a human usually. And finally, there is a manual device. Now we're going to proceed and talk about anesthesia reactions. The type of anesthesia we're going to be using is local anesthetic, most likely the one that you would have encountered at your local dentist. Occasionally, there can be some side effects associated with the anesthetic. Some of these, but not limited to, are palpitations, cardiac arrhythmias, or changes in blood pressure. If you are taking any medications, especially blood pressure medications, please do highlight them on your consent form. Sedatives are medications which may help you feel slightly more relaxed. They are also used to sometimes reduce anxiety and control the heart rate, because some of the medications we use during surgery may elevate the blood pressure and the heart rate. Very rarely, sedatives used can lower your oxygen levels. Therefore, we will be monitoring your oxygen levels throughout the surgery. Should a rare and unexpected drop in oxygen levels occur, a medication will be used to reverse the medication. If you don't have any allergies that we are aware of, we may be using some medications which you could possibly react to, and therefore an allergic reaction may occur. So please do disclose all medications or any non-prescribed medications to your medical team that you may be using at the time of surgery. Steroids are medications that are used to minimize swelling after the hair restoration surgery. Rarely, if these are used for longer than a couple of months, they can cause stomach ulcers or gastritis. If you are using them for longer than several months, they can also cause thinning of the bones. During this procedure, it's very rare you'll be using the medication for more than 7 days, so I find this to be a very rare occurrence. Folliculitis is actually a common side effect, which I think most of you will experience. It's basically a small zit that can develop around the area of the new recipient's graft that's been implanted. What happens there is, as the hair is trying to exit the scalp, you can have a small inflammatory nodule there. We always advise patients to start using an exfoliating shampoo around the 3-week mark, and further information will be given to you post-operatively. Hair loss is a side effect that can occur if we are transplanting hair around existing patches of your own hair. And this is called shock loss, or in medical terms called telogen effluvium. The hair is most likely to grow back in due time. However, sometimes this can take several months or even a year. So when your new hair starts to grow, it may grow back slightly more kinkier or wavier than normal. Over time, this should resolve itself. Sometimes patients will notice there is a different texture to the implanted hair versus the original native hair. And this is because the hair is coming from the back of the scalp, and therefore this can be a different texture to your native grafts. Failure of transplanted hair to grow. Now this is a really important point to cover, because it often produces some anxiety in prospective patients. Is my hair going to grow? What are the chances of failure? We perform every surgery very diligently. We're competent we follow all the steps and protocols to make sure every chance is provided to these grafts for them to survive and then also flourish in the new recipient area. There are many variables involved in surgery, and one of the largest ones is the biology of your own body, how you heal, how your tissue takes. It's impossible to state that every single graft is going to grow. Therefore, we always mention to patients that in every aspect of surgery, there is a risk that some grafts may not grow. Beginning of the donor area. As you know, we are taking grafts from the donor area and then repositioning them to the recipient area to improve the aesthetic outlook. Once we take the grafts from the donor area, they're not going to grow back, and therefore it's important to note there will be thinning to the back of the scalp, or the sides of the scalp. And the more procedures you have, the more evident this thinning is going to be. Unfortunately, the ingredients have to come from somewhere, and therefore this is an inevitable risk of surgery. Redness of the scalp. When the new grafts are transplanted to the recipient area, the roots will become embedded into the dermis, and over time these will grow into new shafts of keratin to afford you more hair. Everyone will experience redness of the scalp, and this will vary from person to person according to ethnicity, skin color, skin type, how long this lasts. I always mention to patients to probably give it at least 6 to 8 weeks. And then depending upon the fairness of your skin, this can last several months, even up to 6 months. So it's always wise to mention that you will have a pinkish salmon hue, which may last several months. Smoking. This is very, very important to disclose to your medical team if you are smoking any type of cigarette products or cigars. Smoking does cause the blood supply to be impeded, and therefore this can affect growth. If you are a smoker, please do discuss this with your medical team, and very strict protocol instructions will be provided to you. It's very important you follow these diligently. Sometimes if you are a smoker who is unable to cease smoking pre and post surgery, we normally advise you surgery is not in your best interest. Sun damage. I always like to advise patients that after surgery you abstain from direct sunlight for at least 2 to 3 weeks. If you are going to step out for a short time, after the 7-day mark, you may wear a very loose hat for short periods of time. Infection. Anything invasive, even taking a blood sample, carries a risk of infection. Of course, with our protocols, we try to minimize this as much as possible. To ensure we are even more aggressive in minimizing this risk factor, all patients are started on antibiotic therapy 1 day prior to surgery, and they will continue this for 7 days post-surgery. Necrosis. What does necrosis mean? Necrosis means cell death. With any type of surgery, especially skin surgery, there is a risk that the cells surrounding the area of intervention may undergo necrosis, i.e. it means they die. There are many factors that may contribute to this, including diabetes, infection, blood pressure. But sometimes this can occur as a normal variance of surgery, and there's no way of anticipating this. This is a very rare side effect, but it can be a very compromising side effect to the patient, because they will be left with a scar, and secondly, the area around the scar will not yield any grafts. If this does happen, you will require further restorative surgery, roughly 8 months to a year after the procedure. Sutures, stitches. If you are undergoing the FUT procedure, you will have 3 layers of sutures in the back of the scalp. If you're undergoing the FUE procedure, it's very common that you may have a few sutures in the back of the scalp just to control any oozing that may occur from the FUE harvesting method. These sutures absorb by themselves, and you may notice a small knot which exists for several weeks, but this is harmless and it will degrade by itself. There's most likely to be temporary swelling around the scalp. This can extend into the forehead, the eyes and the face, and this can persist anywhere from 10 days up to 2 weeks, but usually by 7 days things have subsided very, very well. There may also be bruising around the forehead and the eyes. And finally, there may also be a hematoma, which is a blood clot underneath the scalp. This is quite rare. If this does occur, there may be some pain associated with it, but this does subside over the next couple of weeks. Final results. Prior to the surgery, you will probably have several episodes where we've actually mapped your new hairline and given you a rough idea of what you may expect when the final growth takes place. It's very important to understand that there is no way of guaranteeing that your future hairline is going to follow this exact pattern, because there are so many variables with surgery, how thick your grafts are, the actual coverage we get during surgery, which is completely unpredictable until we actually perform the surgery. Driving caution. Many of you will be given a light sedative during the procedure, or simply after a long day you may feel sleepy. Therefore, it's very important that you are escorted home by a relative or a friend to make sure there are no accidents on the way home if you're driving yourself. We always advise patients who are traveling from out of town to stay at least 2 to 3 days in town. At least then they have some time to recuperate. Follow-up appointments. Please make sure you follow all the post-operative instructions very strictly, and you attend your predetermined follow-up appointments at 6 and 12 months. Unsatisfactory results. So there's always going to be possibility of inadequate growth from hair transplantation surgery. This is a very, very small likelihood, but unfortunately we cannot take this away. And I think it's very important to be honest and upfront with patients about this. This is not because the surgery is done in a substandard way. It's simply because there are many variables that we cannot predict, and therefore it's important the patient has very realistic expectations. So although very good results are expected, and this is why we perform this surgery day in and day out, we are not able to guarantee or provide any warranties for surgery. Surgery and medicine is an inexact science, which means due to the large variables, the outcome cannot be guaranteed or predicted 100%. And it's very important that patients understand this statistically. Mental health disorders and elective procedures. As most of you are going to be having this procedure electively, which means you've chosen to undergo this, it's important that you bear in mind that you must be in a suitable mental condition to make that decision. On the patient expectation forms, there is a long list of situations where, should you be experiencing one of these, you should not proceed with this procedure. Some of these include bereavement, a divorce, you're suffering with mental health issues which are not resolved or uncontrolled, anxiety, if you're very self-conscious about your looks, whereby if there were some complications with unsatisfactory results, it's going to cause you great anxiety. So if you have any of these, please do not proceed with surgery because in my opinion, the surgery can actually cause you more mental distress. Additional grafts. So let's talk about this very, very carefully. A lot of the procedures that I perform on patients, the results are absolutely fantastic and patients are happy with one procedure. However, before I counsel my patients preceding a surgery, I always inform them that hair transplant surgery is not a one-hit wonder, which means that we are going to guesstimate a number of grafts that you need. We're going to perform the surgery, and then Mother Nature will allow you to heal, and then we'll see how the growth looks in a year to 18 months. We have no way of predicting how the final results are going to look. So if on occasion there are some areas of poor growth where some areas did not take, you may need a touch-up in the future, or you may need a larger area to be retouched up. When you are considering your surgery, please bear in mind, if you do require additional surgery, this will be charged as we have overheads and staff costs. And I think it's very important to be realistic about the goals of surgery and understand that this is always a potential risk. Reasonable expectations. Please note, hair restoration surgery is an art and not an exact science. Results from a hair restoration procedure are strongly correlated to the amount of density required versus the amount of grafts transplanted. The density of grafts required is affected by a multitude of factors and variables from person to person, which some of these cannot be predicted. Furthermore, if you are undergoing hair restoration surgery, it is most likely you suffer with androgenic alopecia, also known as male pattern hair loss. With this condition, there will be a downward trajectory in the density of your native grafts, i.e. the hair that you were born with, along the natural evolution of this condition. Should it be deemed you require additional grafts to densify your final subjective goals, then kindly note it is your responsibility to pay for our time and overheads for any additional procedures. Please remember, anti-aging treatments and hair restoration procedures are projects and not one-hit wonders. So guys, this video is not the actual legal consent form that you'll be signing off on. That's actually in paper form that was sent to you in writing. This is simply to help you understand that a little bit better, to give a human touch to it. You will be going through this again with one of our medical team. So please make sure if you have any questions, concerns, or things you don't understand, do not sign that consent form until you absolutely understand. It's very important to understand that once you sign the form, you will be held to the expectations and the risks that you've signed off on. These can sound a little bit scary for most people, but it's important that we're upfront and inform you that we can't take these away. Anyone who is coming to us for an elective procedure needs to be counseled and understand that these are very real and they could occur to any one of us. Therefore, it's important that you balance these risks with the benefits of the surgery. If you do have any further questions or concerns, please do write them down, and these can be discussed with your medical doctor prior to actually signing off on your consent form. Thank you very much.